Let's talk about eyelid asymmetries. So many people are bothered by this incredibly common problem. If you look closely at yourself or someone you know, you will most likely realize that their eyes are not exactly the same. Sometimes it's subtle and sometimes it's really dramatic. Believe it or not, there are many different reasons for that. Some of them are fixable or able to be improved, and some are just not. So let's talk about the most common reasons for asymmetric eyelids or eyes, and we'll talk about whether there's anything you can do about it. Number one, the most common reason that I see in my practice is that the eyebrow is actually lower on one side versus the other. This causes the eyelid on the lower side to look heavier or look like there's more skin there when really it's just the brow position. Sometimes the brow is just anatomically in a higher position on one side versus the other, but sometimes it's due to the muscle tone or activity. If it's due to the natural position of the brow and is present at rest, a brow lift can sometimes improve that asymmetry. If it's due to muscle activity, a brow lift will not really change it, and other things like Botox may help by relaxing the muscle on the overactive side. Number two, you have something called ptosis. This is where the actual position of the upper eyelid is lower on one side versus the other and actually covers more of your pupil. This can make you look very sleepy or tired. This has to do with the muscle that lifts or elevates your eyelid. This can frequently be addressed with surgery to actually repair the muscle, but it can also be temporarily improved in a lot of cases with an eye drop called Upneek that actually stimulates that eyelid muscle to contract and lift the lid. Some people will use those drops even if they don't have ptosis just to look more awake. Number three, a third reason is that the entire eye socket or the orbit is actually smaller or larger on one side and sometimes even higher or lower than the other side on the face. This can affect the appearance of the eyelids. For example, if one eye is smaller than the other, that eye will sit farther back into the eye socket and there will look like there's more eyelid skin or even a lower brow, sometimes no matter what you do. You can improve it with surgery, but to some extent, it will always have a difference. Number four, believe it or not, this is one of the least common reasons I see, and that is when there's actually just more skin on one eyelid versus the other. This can be easily addressed with an upper blepharotomist. Thanks, and hope that was helpful.